in trauma, our brain does, especially if it was childhood trauma, our brain does suffer changes physically, like that you can see. And that's what can generate the symptoms of ADHD. If it's preventing your brain from fully developing, right, then it's going to impact you. And like I said, I think it was in the previous episode, with ADHD, we're 2 years behind developmentally, right? So with trauma, if you were neglected, you may already be developmentally behind because of the neglect, right? And that created changes in your brain, which then later is going to create symptoms of ADHD. And it's been studied. So Russell Barkley is the psychiatrist that researched ADHD, I believe, for like 40 years. So most of what we know about ADHD is because of him. And so he did several different studies, but one of them was that children who were treated for ADHD as children, right, like at a young age, have a higher chance of having their symptoms under remission when they're adults. And they also have lower chances of developing addictions. Because when you don't treat it, and if you become an adult, right, you have higher chances of having depression and suicidal ideation. You had higher chances of having anxiety and being a victim of trauma. So ADHD makes us propense to trauma. Because we're impulsive, right? We're just making decisions based on how we feel rather than what are the consequences. Yeah, sorry, I've been losing my train of thought today, but
You're fine.
But oh yeah, and then we have higher chances of becoming addicts, which may not be on the normal sense of the word, right? It can be workaholism, it can be eating disorders, right? Or substances.
Yeah, but I think that's really important to point out, because when people think addictive or addictions or addictive, I can't talk, addictions or addictive tendencies or behaviors, they automatically think drugs and alcohol. Check us out on YouTube at Reah Higgs, ReahHagues. You can also keep up with us on Instagram at Just the Who Podcast.